the severe acute respiratory distress syndrome, which began in mainland China and brought back to Hong Kong, and then spread to the world. And this room here is sort of ground zero, where the patient index 0 stayed in the Metropole Hotel in Hong Kong. And it's believed this knobs here is the lift which possibly most of the patients got the infection from. So we've been here before. And if you looked at the SARS history, how it traveled to the rest of the world, and we thought that was the next big pandemic where many people would have died, and many people did die. And countries which were hardest hit by SARS, if you look at this diagram here, Singapore, Vietnam, and Hong Kong, had response which was a little bit different, perhaps, as to compare to countries which didn't get much affected by SARS itself. And we just got lucky. SARS died down eventually, and then life got back to normal. And we've had many close instances of emerging infectious disease with the potential to cause pandemics worldwide, but we got lucky. So if you remember, there was the Ebola outbreak, there was the Zika outbreak, there was the 2009 H1N1 influenza outbreak, which most experts thought would be the sort of the big pandemic the world would see and come to its knees. But we managed to see through that. And now H1N1 is one of those circulating viruses which we see in people who come in influenza sometimes. So the lesson here is we always knew the next big outbreak was coming. We even made movies about it. If you remember the movie Contagion, basically it's a reenaction of somewhat what we're seeing now, emerging virus that spread from animals to humans, causing a worldwide pandemic. And for Malaysia itself, this is not new to Malaysia. Malaysia has had emerging infectious diseases which it had contained before. Malaysia had the experience from managing Nipah in 1999. 2001, we had a bit more experience managing the influenza then. More lately, the Middle East respiratory virus, which the MERS is synonym for, was something which we sort of had to grapple with. So Malaysia started off with the foot of having experience managing emerging infectious diseases. And then, as you rightly mentioned, in December 2019, you heard this news of young people getting, in very bad lung infections, very bad pneumonias in the hospital in Wuhan. And obviously, initially, as any emerging infectious disease, the information that comes through is perhaps a bit fragmented, because you had to put the picture together, so to speak, because the consequences of taking action without knowing exactly what's going on can be quite devastating as well. And I think in January, where WHO declared it a public health emergency of international concern, and sometime in later February, the virus itself was called SARS-CoV-2, which caused the disease of COVID-19. And in March, it was declared a pandemic. And from then on, Malaysia obviously had taken action very early on to sort of try to manage it. So there were definitely many conversations in the Ministry of Health itself, in local hospitals, on how you're gonna sort of grapple with the virus when it comes to Malaysia. I think after a few months, you knew it was human-to-human transmission. You knew that it was spreading all over the world. And then the world watched what happened in Wuhan. I think most of us who were on our televisions, on our internets, on our phones, on social media, watched on a daily basis what Wuhan went through. And these were some really striking images that came through on the situation on the ground itself in Wuhan. I think a lot of us feared for the worst, prepared for the worst, but also obviously hoping for the best. And I think this somewhat prepared most of us, I suppose, from the medical side of things, as mentally, because from an infectious disease perspective, we always knew that we are at risk for an emerging infectious disease. We always knew there was going to be a zoonotic spread, and we have experience with this managing before. And this is sort of the early Malaysian clusters, if you remember, the imported case from China, tourists from Singapore coming over to JB, eventually being detected having COVID. And then obviously had the local clusters, the early ones being in Kuala Lumpur and Selangor. Then there was a large Tablet cluster, which had we underwent our first movement control order to sort of contain. And then we successfully sort of brought it down and flattened the curve, so to speak, with numbers of recoveries, which is probably one of the most impressive in the world, with about 96.99% recovered, and keeping the mortalities really, really low. And that's partly because the ICUs were prepared to cope. Many of these ICUs were repurposed to manage COVID patients, and you had healthcare workers remobilized from normal areas of work to do more COVID work in order to respond. And this is not just unique to Malaysia. I think if you look at it worldwide, everywhere in the world, you have countries grappling with COVID, healthcare workers having to repurpose and do work which perhaps initially they're not trained for, but they were trained and now they're able to do. And this was something really useful which we did early on. We had the privilege to have the host Chinese colleagues who have from the epicenter of the outbreak itself, having conversations with them, getting insights in their perspectives on how they dealt with things. And I think that was a very important sort of dialogue session which we had, from the experiences of repurposing hospitals, experiences of public health on how they dealt with things, from the clinical aspects of things. For clinician, yes, you see a lot of infections, less you see a lot of respiratory infections, but this was something new to all of us. I think for a clinician like me, it was literally reading every day about something new, particularly in ill patients and how you sort of treat them and how they respond to treatment. And even now, you're still learning something new about the virus. So we initially thought it was all a short-term respiratory virus. Better idea now, you probably have long-term complications associated with the virus. So it's a learning process for most of us. And I think this opportunity to share insights with the Chinese colleagues was really helpful early on in the outbreak, when we were able to get their insights and perspectives on management. I think this is the curve that you've seen from the post-election itself, increasing daily number of cases post-elections, and the hardest hit state obviously being Sabah. I think this is a graphic that the Ministry of Health sort of puts out on the capacity to respond to outbreak itself. And I think this is something important because there's a commitment ministry-wide to make sure that there is containment of this virus as much as possible, both in the public health side and also in hospitals. And I think this is something you don't see in many countries. You have countries who've let go of the virus, in its peak, and it's in a community, and they start grappling with how they control the response in the communities itself. But I think Malaysia has made a conscious decision to contain the virus as much as we can, and the preparations of both the hospital services and also the public health in managing it. Was it easy? I mean, I don't think it's easy. You agree with me? On even a normal day-to-day basis, hospitals, and particularly public hospitals, have always had a lot of patients. But it's a challenge. It's times of sort of crisis, and in times of crisis, you have to think out of the box. So there are many times here where the whole hospital management sat together, the state health department sat together. We had different agencies coming together on board, thinking how you could do things differently, repurposing areas in the hospital, repurposing assets that the local Ministry of Health has. For example, this picture here is one of our physicians in the mobile bus service. So we took the X-ray services to the community, so we triage patients in the community itself and pick them up early, those who require low-risk quarantine care and those who risk hospital care. This is a picture of Queen Elizabeth Hospital, the largest tertiary hospital in Sabah, which is also a COVID hybrid hospital, which was repurposed for COVID management. And then obviously there's a lot of work that goes in hospital as well, when you're repurposing areas within the hospital for different purposes. And this is where we saw leadership from all walks of society and departments in the hospital. You had the orthopedic surgeon saying, look, you can take my troops, you can tell me what you want me to do and I'll come on board. You had the dental doctors who said, look, I could help you with taking temperature and seeing patients who are low risk to begin with. So it's a whole hospital response. It's not individual response, obviously. It's not an ID response. And people just, like came down and said, look, how can we help? How can we make a difference? So it was that kind of commitment that makes a difference in times of crisis. We had community involvement. I can't stress enough how communities in Sabah itself got involved in galvanizing support and help for frontliners when we needed them. And this is a picture of low-risk quarantine isolation centers. So this is something that we had prepared from the first wave in March. And thankfully we didn't have to use it then. But the preparation was there. The idea that this is obviously going to be hitting us again because it's just so easy to spread was there. And we had low-risk isolation centers prepared. This is one of it in the Likas isolation center. And then obviously when hospitals had to be repurposed for COVID, we had support for other agencies, for example, the Ministry of Defense, who helped us with the field hospital in Tawau to help cope with patients who are non-COVID in these centers. And I think this sort of really melts your heart when you have colleagues and doctors, nurses, paramedics from different walks of life volunteering, coming over to Sabah to help us with the response. And this is not unique. Even if you remember from the first Chinese experience when they had this sort of big outbreak, they had mobilized healthcare workers coming over to Wuhan and Hubei to help out colleagues. And this is exactly the same response which you see. This is ordinary Malaysians, ordinary Ministry of Health workers who sort of are doing day-to-day job, volunteering, coming to the front lines and helping with the whole response in Sabah itself. And this again, I think this is some images within the hospital, just everybody putting their hands, putting their boots and going to the trenches, so to speak, to help with the response. I always use the analogy, this is the biggest pandemic we battled since probably the last 100 years, from the Spanish flu in the last 100 years. So it's not going to be easy times, but you just have ordinary people raising to the challenge on everyday life in the front lines. These are images of some of our doctors who are in the front lines itself. I just like to share this before the last couple of slides. Managing a viral pandemic is not the healthcare service alone. There's individual personal responsibilities to things, and then there's also the whole shared responsibility. So physical distancing and staying home when you're sick, there's obviously a personal responsibility, wearing masks when you go out, then the hand hygiene and cough etiquette, which is taken care of, which is all on the personal aspect of things, avoiding touching your face quite often, limiting yourself from going to crowds and big gatherings. And then there's a whole aspect of shared responsibilities, both within communities and also government agencies, testing, tracing, isolating patients who come into contact with patients who are positive, and then There's also government aid and financial support that happens. Isolation and quarantine, which is facilitated by the ministry and the government itself. And then also, when a vaccine becomes available, a vaccine for the population itself. Just last couple of slides. I can't stress enough. This is not going to be the last time we're going to see emerging pandemic. With widespread land use change and climate change, and if you don't have a control over wildlife trade, wildlife consumption, we are going to see repeated pandemics. Somebody quoted, "We are in an era of pandemics." It is our responsibility to take it back, as in to do more to conserve the environment, to do more to conserve climate, and to do more to prevent illegal wildlife trade and consumption. Just a few thoughts. I think it was not so much of a reflection, but what I've sort of learned. It was never going to be easy. I think we all knew that. It was never going to be easy. We were always going to be stretched. But it's rising up to the challenge. Rising up to the challenge and doing what you sort of take it, your Hippocratic oath to begin with. That's from a medical perspective. And in times of challenge, there's always solutions to it. I think we had great people thinking out of the box solutions to solve some of the problems we had. And in every crisis, there is opportunities to solve problems which have always been there, because there's just a lot more leeway to solve problems that have been there. And to succeed, it's just not one organization or one person alone, obviously. From a hospital perspective, obviously a whole hospital approach. MOH would be a whole MOH approach, both public health, the hospitals, getting together private sector in to help where they can. It needs a whole government approach because it's just not the Ministry of Health. There's obviously different agencies with different roles in assisting and managing the pandemic. And it also needs the society to come on board to help with the whole problem and also the solution as well. I'd like to acknowledge a few of them for their pictures and slides here. And I'd just like to end this quote by the former Surgeon General of the States, Vivek Murthy. Our greatest moments are when our head and our heart fuse together, when our sense of mission is married to our knowledge, and we bring that to bear in the service of the patient in front of us. With that, I'll thank you.
But I think the general concern of the Malaysian population and something that has been highlighted, not very often, but in sections of the media, is the emotional toll and the mental toll that it is taking on us caregivers in the front line. Now, I know as doctors, we are used to multiple choice questions. So I'll ask you, is it bad, very, very bad, or none of the above?
I think it would be a bit disingenuous to say it's not a problem. It is emotional, both emotional and a mental sort of, not toll, but it's always in your mind. It's always playing in your mind. And obviously in positions of leadership, perhaps a little bit more, because you're looking at people below you. They're looking at you for sort of inspiration. They're looking at you for direction. They look at you for sort of making sure that things happen correctly, and also for the other section, the people who are who are doing day-to-day work. Some of them have to do more than what they used to. So it's about coping. It's about getting help when you need it. The State Health Department has been extremely gracious to sort of have helplines, mental helplines available for frontliners for easy access if they had problems. And it's important, I say, when I tell my doctors, always ask how you're doing once, and always going to ask that again. because you're never going to get the right response the first time. And it's about looking out for each other. So yes, it's been a challenge, but at the moment, I think generally people are coping quite well. It was a lot more difficult initially because it was just repurposing a lot of things, and a lot of things had to be done differently. And once things are in place, you sort of get a feel, you got a bit of control of things, and things just takes its course.
What about manpower? Do you think you have enough? Do you think the federal government is helping the state enough? I noticed that there are a lot of people who are deputized or seconded to the state, and that is a very reassuring thing. And are they helpful? Do they?
Yeah, I mean, so traditionally Sabah has always had has not been the most popular destination for people to come sort of to work and serve. But that being said, the people who are here have been absolutely dedicated to sort of being here and leading response. And I think the people who are coming through from West Malaysia definitely made a huge difference in a lot of places. So sort of bigger cities, you're probably a bit more okay. For example, Kota Kinabalu, obviously you have a little bit more leeway with doctors having to help and nurses having to help the response. The smaller side, the smaller areas, there were reinforcements from West Malaysia quite early on when they realized how big a problem it became, and that's always reassuring, and definitely it also means that the people on the front line there know that people are reaching out to them and are keen on helping them, and keen to make sure that we are on this together to make sure the response is appropriate.
One last final question before I let you go. What about the number of doctors and nurses and medical caregivers coming down with COVID? Just from treating sick people, is that an issue? Is that a concern?
Right. So I think it's always sometimes when you read reports in a press, sometimes it's easy to sort of misconstrue. There is COVID obviously in a lot of our in the area to begin with. So for a fact, I think the ministry has sort of looked into the numbers and how they sort of would have got COVID. Patient care with COVID itself. I always tell my doctors, taking care of the COVID patient is probably the safest place because you're wearing the appropriate personal protective gears. You know that patient is perhaps infectious, and you're going in all with the right precautions. For certainty, I can say for patient care of COVID itself, there's the COVID transmission. There has been transmission among healthcare workers from the community. That means, whether it's from home or whether it's from outside, there has been. And there has been transmission among healthcare workers in crowded, closed areas. I think if you remember from the early part of the year, where you had healthcare workers perhaps when they're having lunch or having dinner in the pantries in hospital, sometimes let their guard down in the sense that don't, because you're eating, you can't wear a mask. So sometimes there has been transmission from there, but not from patient care itself.
All right, I think your half an hour slot is over. Thank you very, very much, Giri. I think on behalf of all of us from the Medico-Legal Society of Malaysia, and I think 34 million Malaysians, let me reiterate the fact that all of you are indeed our superheroes. Continue the good work that you're doing. Reach out to help. Reach out to us for help if you really need it. And God bless and Godspeed. Thank you so much.
Thank you very much, Dato', for having me.